Again, JCELIS34 @gmail. But for sure, how you doing, sir?
Good. How are you?
Good.
I'm gonna try not to mute my my computer for this session.
Yo, I was dead yesterday. Everybody was trying to get a hold of you. They're like, Mike, Mike.
So next time, just like wave, just be like, "Hey, something's wrong." So it was really quiet. It was weird because I get messages
Celise, I'm gonna send it to you.
through my
Okay,
MacBook.
thank you.
I'll try to mute the Mac.
No,
How's you guys' day? Anything crazy?
nah, just tired.
Not at all.
Not quite. I guess we got like 1 minute left. So we'll wait for the people to join.
Okay, Celise, I sent it to you.
Thank you, bro. Appreciate it.
No problem.
Any problems like logging on? Everybody's logging on. Okay.
Yeah. I was surprised to see that Blackboard was updated. It was a little different. I was confused for a second, but I like it better.
A little different, right? Little refresh, I guess.
Yeah.
All right, so it's about 5:30. I'm gonna go ahead and get started. We're gonna be talking about chapter 27 today. Let me just go ahead and share my screen here really quick. You guys see that okay?
Yes.
Okay, cool. So chapter 27 starts on page 637 of your textbook. And we'll kind of go over some objectives before we begin. So in this chapter, we'll define pathology and identify the dental assistant's role in this specialty. And we'll characterize the process of inflammation, including acute and chronic inflammation. We'll identify oral lesions according to placements. We'll identify oral diseases and lesions related to biological, physical, and chemical agents. And we'll identify oral conditions related to hormonal disturbances, also developmental disturbances, and nutritional disturbances. We'll discuss oral cancer and its warning signs and identify the conditions and lesions of oral neoplasms, which are just a fancy term for tumors. We'll identify oral lesions related to HIV and AIDS and describe the conditions related to miscellaneous disorders affecting the oral cavity. All right, so let's go ahead and begin here. So oral pathology is defined as a study of oral diseases, their causes, if known, and the effects on the body. And dental assistants do not diagnose oral pathological diseases, but they might alert the dentist to abnormal conditions in the mouth if they do see them. So it's important to know what they look like. Oral pathology can originate from many disturbances, including biological, physical, chemical. In addition, can include other disorders such as reactions to stress and antigenic substances. Antigenic just means something that's capable of causing an antibody production. So viruses, for example, when they're introduced into the body, they are an antigenic substance because we do, make antibodies to viruses so that we don't get that specific strain of virus again. Palpate just means we'll to feel around the body with the fingers to look for lumps and bumps and things like that. A biopsy is just a surgical removal of tissue. And the reason a biopsy is done is to find the etiology or the cause of the disease. The body responds to diseases and injury with a process known as inflammation. So white blood vessels are attracted to the chemicals of inflammation, and histamine brings out the inflammation process by increasing blood flow to the involved area. So some signs of inflammation are redness, heat, swelling, and oftentimes pain. Any questions so far? We're okay with this one?
Yeah.
Yep.
So the dentist often examines radiographs and does a physical examination of the area of concern when a patient comes in. The patient's genetic and medical histories are reviewed to determine if there is a risk for a specific type of disease based on past medical conditions or family predisposition. So that's why they ask you medical histories and certain family members have certain diseases. The dentist may choose to biopsy tissues that are abnormal to conduct further examination of the problem areas. All data is then analyzed and a diagnosis is presented to the patient with a treatment plan. And the dentist then evaluates the treatment actions to determine if the diagnosis is accurate and being impacted by the treatment. If not, a new course of action can be planned. We okay with this one?
Yes.
All right. Abnormal tissues in the oral cavity are called lesions and are further classified according to their placement in the surface of the mucosa. So for example, the 4 classifications are above the surface of the mucosa. So that's somewhere where we can usually see below the surface of the oral mucosa, even or flat with the surface, or flat or above the surface of the oral mucosa. We'll kind of go over some different pathologies in each category. So lesions above the surface include the following, all these different lesions from blister all the way to vesicles. A blister is a raised area, usually oval or circular in shape, that is fluid filled, and fluid leaks from the blood vessels to underlying layers of the skin following some type of trauma, such as a burn. It can be friction or disease. Fluid also protects the damaged tissue from further damage. And a bulla is a large fluid-filled blister that's usually greater than 1/2 of an inch in diameter. A hematoma is a lesion caused by bleeding from a ruptured blood vessel, which appears as a raised, bruised area due to the collection of localized blood clot. Dental assistants should watch for the pressure of this area to disperse the blood in the tissue, which alleviates the pressure. So if a dental assistant finds something like a hematoma, they can alert the dentist about the condition. And then if you apply pressure, it'll kind of make that fluid in that area kind of dissipate to the tissues around it. And that'll often diminish the pain a little bit. So that's something that you can do as an assistant. A papule is a small, solid raised area of the skin that's usually less than 1/2 an inch in diameter. And the surface may be pigmented in color and either smooth or bumpy in texture. Plaque is a raised or flat patch in the oral mucosa. This term is not to be confused with dental plaque. You can think of a plaque as an actual like plaque on the wall. So there's different types of contexts, not the plaque that you can get off of, we polish off with patients, but an actual patch in the mucosa. A pustule is a small pus containing blister. A person may see a pustule during a non-infective acne. A pustule at the end of the eyelash follicle is known as a stye. So there's different types of pustules. Vesicles are just small fluid-filled blisters. Some examples of lesions below the surface are abscesses, cyst, erosion, and ulcer. An abscess is a concentrated area of pus formed as a result of infection by a microorganism. And dental abscesses are periapical, which means that they are at the end of the tip of the root of the tooth. Or periodontal, which means that they're caused by microorganisms invading the membrane of the tooth. A cyst is a fluid or semi-solid fluid-filled sac. The causes of cysts are numerous, and in dentistry, they normally occur as a result of a duct leaking from a fluid-forming gland becoming blocked. Cysts can develop around the crown of an undeveloped tooth prior to eruption. And erosion is the defect left from a trauma or an injury. can also arise from a person biting their cheek. So the margins of the cheek erosion are red and painful. An ulcer is due to destruction of mucous membrane and appears as an open sore on the tissue. It may be shallow or crated crated deeply and is normally inflamed and painful. So one of the things about ulcers is an ulcer can be caused when like a dried cotton roll is removed too quickly from the mouth. It would have to be pretty dry and pretty stuck to the tissue, and you would have to pull it out pretty hard. But if you do that, you can sometimes cause ulcers in the mouth. A good note on that is just to wet the cotton roll a little bit before you try to take it out, and then just kind of roll it out. Don't yank it out of the mouth. Some lesions even or flat with the surface include ecchymosis. This is a medical term for bruising of the tissue. A macule is a spot or of different texture or color on the skin. A patch is an area of skin that appears differently than any other surrounding tissue, either in color or texture. Petechiae are small spots, red or purple in color, that occur in the skin or mucosa tissue. They are also caused by localized hemorrhage. A purpura is caused by bleeding within underlying tissues. These purplish or reddish brown areas or spots of discoloration can range in size from a diameter of a pinhead up to about 1 inch. Small purpura normally are referred to as petechiae, and the larger ones are called ecchymosis or bruises. And then these are just lesions that are flat with or above the surface of the oral mucosa. They include granulomas, neoplasms, and nodules. A granuloma is associated with the chronic inflammation and appears as a neoplasm, which is just a tumor that is filled with granulation tissue. The suffix oma refers to neoplasms or tumors. So anytime you see an oma in any medical term, that's what they're referring to, is some type of tumor. A neoplasm is a medical term for a tumor. And this new abnormal growth that serves no usefulness can either be malignant, which means it's life-threatening or cancerous, or benign, which is non-cancerous, non-life-threatening. A nodule is a small lump of tissue. It can either be hard or soft, that is usually more than 1/4 of an inch in diameter. It may either protrude from the tissue or from beneath the surface of the tissue. All right, so what type of lesion is a macule? Who remembers?
Even or flat?
Even
Right.
or flat, right. That's what a macule is. So it's even or flat with the surface of the oral mucosa. Very good. All right, moving on. So we have biological agents that can cause pathology. Actinomyosis is an organism obtaining access to the bone through the dental socket after a tooth removal, which is thought to be the contributing factor. And it can cause infection, which is caused by bacteria. It often is accompanied by painful swelling, pus, and discharge. And sometimes it can be brought on, I guess, stronger by poor oral hygiene. That's just because we're introducing more bacteria into that tooth socket, which is causing more actinomycosis. Other biological agents include herpes simplex, and there's there's different types of herpes simplex. We have type 1, which means it's above the waist. This is usually in the form of a cold sore, and cold sores are called herpes labialis, just herpes on the lips. Type 2 herpes simplex is below the waist. This is commonly called genital herpes. And herpetic whitlow is a crusting ulceration on the fingers or hands. It can be extremely painful. It's caused by that same herpes simplex virus. Dental assistants must be really careful, especially in working with patients that have herpes, because herpetic whitlow is something that's common with people in the dental field if you're not careful. You guys stop me if I'm going too fast or you have any questions, please. More biological agents include aphthous ulcers, which are common ulcerations that reoccur in the oral cavity. They appear circular with the yellow center in the middle, the yellow center, and they usually have a red circular kind of border. We call that an erythematous halos, that red border. That surrounds the lesions. Patients refer to them usually as canker sores. Herpes zoster appears as a unilateral, painful lesion that can last up to about 5 weeks. It causes varicella in children and may lay latent or dormant and then activate at a time when the person is immunodeficient. HIV and advanced cancer patients are predisposed to herpes zoster. Syphilis is a venereal disease caused by bacteria that may be treated with antibiotics, and it has 3 primary stages. The first stage shows with the primary lesions. Lesions usually are in the mouth, feet, hands. They're about 1/2 of an inch in diameter. That is hard and raised. The second stage begins with flu-like symptoms, and then it's followed by 1 or 2 types of lesions that are extremely infectious. And then during the third stage, a gummy or localized lesion appears, and it can also occur years after non-treatment. If somebody has syphilis and they don't treat it for years, we have these localized lesions that appear everywhere, and it can actually destroy bone and cartilage. There's some pictures in your book on page 641, figure 27-3. It's just somebody with a lip canker from primary syphilis. It almost looks like this like circular indentation in the lip. So if somebody has that, then it's usually pretty infectious. So you want to be very careful with that. Cellulitis is just a bacterial infection that can spread very quickly. It's usually associated with skin and soft tissues. It's characterized by swelling, redness, heat, and tenderness. And then we have some physical agents, or things that physically cause trauma to the mouth. So dental irritation can cause something called hyperplasia. So an ill-fitting denture can cause these small ulcers after continued irritation. And after that, they become folds of excess tissue. And you can see here, these little folds of excess tissue are called hyperplasia. An amalgam tattoo can occur when amalgam particles become trapped in the tissue, either during oral surgery, an amalgam filling, or crown preparation procedure. See, there's just somebody with amalgam tattoo here. It almost looks like a piece of amalgam got stuck inside their gum tissue, which is exactly what happened in this case. And it'll just stay there. We just leave it there. Other physical agents are radiation exposure. A radiation injury is when a patient receives too much radiation. In this case, teeth can be malformed, dwarfed, or without roots, depending on the stage of development. Tissue within the area may appear pigmented, or spider-like vessels may appear in the skin that appears to be atrophied. Necrosis can occur, which is the death of the body tissue in the area that was radiated. So it is caused when there is not enough blood flow to the tissue, and this condition is irreversible. So once any type of tissue becomes necrotic, it's dead tissue that usually has to be removed. Other physical agents include oral piercing and tongue splitting. Potential issues with self-expression include oral piercing. This can often lead to tongue swelling and sometimes can become infected or cause teeth and tissue damage. Metal hypersensitivity can occur, scar tissue development, and problems with chewing is common. Speech can also suffer, and bacteria can be introduced and more difficult to clean around, especially around like tongue piercings. And treatments can be affected, like radiographs. We all know that we can't see through metal in a radiograph. So somebody with a metal tongue piercing or any type of piercing, it'll just get in the way. And you can see this patient probably is always chewing on their bar from their tongue piercing. And it results in this. We have that kind of gap in between. It'll often chip the heck out of teeth. I've seen some of these tongue piercing bars can wreak havoc, especially on the front teeth. Tongue splitting is something that I've only seen really once, but this is when people split their tongue at the tips so that it gives them like a reptile appearance. That can introduce lots of bacteria and risk of infections. There's also huge arteries that run down up and down your tongue. So if any of those get cut, it can be actually pretty dangerous. People that have their tongue split often have difficulty swallowing and even talking. So if a cotton roll becomes dry and then is removed quickly, what type of disorder or injury could be caused?
Canker sores.
Canker sores is one, but there's
A lesion. Was it a lesion?
What is a canker sore?
Well, not a canker sore, but at least some type of sore. I forgot what I remember hearing you just said it.
It starts
earlier.
with an A. Ab something ulcers.
It's an ulcer, yeah. So
yeah, that.
Yeah, there goes.
I just lost my place. Hang on. There we are. And gingival ulcer. Yeah. So once again, you would really have to pull really hard, and then you would have to pull some tissue out with it. But it can be really uncomfortable when you pull out a dry cotton roll from someone's mouth. So just wet it a little bit with some water and then roll it out. It's better than just yanking it out of their mouth. Okay, good. Moving on. All right, so we can also have chemical agents that cause pathology in the mouth. Aspirin burns occur when people place aspirin, and I think this is interesting every time I hear it, but sometimes people place aspirin actually right underneath their lip. The thought is that it'll alleviate tooth pain prior to seeking dental care. And that might be true, but it caused severe acid burns, which don't add or don't take away to, aren't going to take away the pain. It's going to add more pain, if you ask me. So aspirin burns are something that you might see. We can also see things like nicotine stomatitis. This is when chemicals from tobacco and heat affects tissues inside the mouth. And this is usually with pipe smokers, with that direct heat just always almost cooking the tissue. And this causes hyperkeratinized tissue. So if you look closely on the palate of this patient, you'll see these like little dots everywhere. They're kind of raised. That's just keratinized tissue. It's just that stomatitis from all those chemicals and heat constantly hitting that area. All right, this next picture haunted my dreams for quite a while.
Yeah.
This is this is a picture of a black hairy tongue. Nobody really knows exactly where black hairy tongue comes from. It's thought that it comes from the use of antibiotics, or sometimes people will swish with hydrogen peroxide in hopes that they'll kill all of the bacteria in their mouth. But what that can sometimes do is kill all the good bacteria, while all the bad bacteria kind of cause these little, they're like little, okay, so it's not actually hair. What it is are papillae of the tongue. So these are these little hair-like projections that everybody has on their tongue here. But sometimes they can grow really, really long for some reason. And especially people that smoke or use chewing tobacco, it'll actually stain black and it'll look like black hairs in the back of their tongue. Sometimes it becomes so severe and those papillae become so long that it'll actually cause patients to start gagging because there's always that hair on the back of their throat. It's kind of awful. I've only seen it once, but it was, it's not as bad as this. This textbook is like the worst case scenario. And then just chewing tobacco or snuff lesions appear in the oral cavity also, usually in the vestibule. We also have meth mouth. So methamphetamine is more common than ever in today's society. This drug can devastate the oral cavity. The acid of the drug causes cravings for high caloric carbonated drinks, leading to tremendous decay. There's a picture of meth mouth in your book on page 646, figure 27-17. Sometimes it can be so devastating to the mouth, it actually looked like a small bomb went off in there, just because of the rampant decay that we get. We usually see that on the cervical third, so right near the gum line is where we have a lot of that decay from meth mouth. Moving on. Gingival hyperplasia occurs when the connective tissue grows over the teeth. A lot of times we see this. Actually, so a lot of times we see this in school-aged children around puberty, just different hormones acting up. We'll also see gingival hyperplasia when orthodontic patients. They can sometimes develop sensitivity to the metals in the mouth on top of all the different new places where bacteria can hide if they have braces. So that's just what that little bulbous gingival area that kind of overcrowds the teeth a little bit. That's what that is. Hormone disturbances can also affect the mouth. Pregnancy gingivitis is where the gingival tissues appear enlarged or inflamed. This occurs in about 5% of pregnant women. And then pyogenic granulomas can be found in anyone, although it's more commonly referred to as pregnancy tumors. This overgrowth of granulation tissue is caused by a hormonal disturbance during some women when they're pregnant. Puberty gingival enlargement is where adolescents may develop swollen gingival tissue, just like pregnancy gingivitis, that will disappear over time. And all of these conditions are temporary and clear up after the hormone balance returns to normal. So a lot of these pregnancy gingivitis or pyogenic granulomas that occur in pregnant women, usually it goes away once the baby is born. Some tooth development disturbances include amelogenesis imperfecta. This is when, this is actually a genetic condition of the teeth where the enamel is discolored. It can be partially missing, so chips off easily, and very thin. People with very thin enamel, their teeth almost look yellow because that's the color of dentin. And so if they have thin enamel, we're just seeing right through whatever enamel they have through the yellow dentin. Ankylosis is a condition in which the tooth, cementin, or dentin fuses with the alveolar bone, restricting the movement of the tooth as well as eruption. So dentists may have to use a handpiece and burr to separate the tooth from the bone to remove it in the socket. And just one more thing with ankylosis, it's something that naturally occurs, especially in elderly people. So that's why they say another reason why if you ever have wisdom teeth, it's easier to get them taken out when you're younger, because as we become older, especially 60s, 70s, and older than that, ankylosis can set in. And if any teeth have to be extracted, it can be often pretty difficult. And we actually have to use a burr to separate the tooth from the bone. That's something that you want to know for the final, by the way, ankylosis, and what it is and why we get it. Okay, so anodontia is when teeth are congenitally missing altogether. Dentinogenesis imperfecta is is the condition in which the enamel appears to be opalescent and chips away from the dentin soon after eruption of the tooth. fusion is a condition in which the enamel and dentin of two or more individual teeth join together. And germination may appear much like fusion, but in this case, a single tooth bud attempts to divide.
Is opalescent like transparent?
Kind of. It sort of has different, because of the way, let's go back to that one. So because of the way the enamel is, it kind of looks almost like a pearlescent type, but it's very chalky, and it's usually pretty brittle and chips away.
Oh, okay.
Yeah. Let's see. Macrodontia just means abnormally large teeth. Microdontia is abnormally small teeth. Nothing too crazy with those terms. Neonatal teeth are teeth that are present at the time of birth or within the first month after birth. So yes, we have these rumors that some babies are born with teeth. It's true. These are called neonatal teeth, and they usually fall out quickly because the roots have not yet formed. This is not their primary teeth, so don't worry if you ever have any kids that have these natal teeth and fall out. They will get their primary teeth underneath that. These are just, for whatever reason, sometimes we have these premature teeth that kind of try to grow.
When do they fall out?
Usually it comes out within the first month or two.
Really?
Sometimes they might not. If they actually have roots that have started to form, sometimes they'll be in place of their primary teeth, or sometimes they'll have an extra tooth that'll form beneath it, and so we get what we call like shark teeth, or extra rows of teeth. And those those will fall out over time as the permanent teeth kind of grow into place.
Oh, so they basically have like 3 sets of teeth. Like they have the ones they're born with, then they have the primary teeth.
Yes. Mm-hmm.
Oh wow, that's crazy. My niece was born with her 2 front teeth.
Oh, was she? Did they ever come
Yeah.
out, or did she get extra teeth?
No, they haven't came out yet. That's why I was like,
They were just
whoa,
born like that. She was born with them, huh?
Yeah, she was. Everyone was surprised because she like started crying, and her 2 teeth were like big.
They were already there.
They were like you could
Yeah.
see it.
So that happens.
How old is
Sometimes
she
they're already
now?
there.
She's 3 now.
Oh, and
They
she still
haven't
has
come
them?
out.
What? That's crazy.
Yeah, so you see some neat things. Sometimes people have extra teeth. Sometimes teeth are missing. Sometimes we have peg laterals. All kinds of funny things can happen.
Neonatal teeth.
Neonatal teeth, yeah.
Neonatal.
Supernumerary teeth are just extra teeth. That's all that means. These are teeth that usually appear dwarfed in size and shape, but normal in all other aspects. So they're actually teeth. Some people will actually have multiple wisdom teeth that shouldn't be there, but are usually removed with surgery. Twinning is a condition in which the germination process has been successful and 2 separate teeth are made from the same tooth bud. So they appear as a clone of the original tooth, both in shape and in size. All right, are we okay with this slide?
Yeah.
Okay, so some other developmental disturbances include oral tori. These are just bony overgrowths of tissue, and they are benign in nature, and occurs in about 20% of the population. Exostosis is an enlargement or a nodular outgrowth of dense lamella bone that appears on the facial surfaces of the mandibular and maxillary palates. So there's just another type of tori. It's just usually on the facial surfaces, whereas when we talk about tori, or actual tori, it's almost always in the lingual surfaces. And so this is what oral tori looks like. And if you don't have any tori, or if you've never seen it before, sometimes it can be alarming, especially when you go to try to take x-rays. Imagine trying to take some bite wings on this patient. It can be pretty painful, especially during x-rays. But this is just what this is. It's not abnormal. We see it in a lot of patients. Sometimes they can, oral tori can actually get bigger. It's thought with from bruxism. So if patients are heavy grinders, and it looks like this patient probably was, you can talk about a mouth guard or a night guard with that patient. That'll sometimes slow down the growth of these tori. Some patients also elect to have them removed, which is possible, but usually they will grow back after. This is an example of vortices spots. These are just granules in the oral cavity. There's nothing abnormal about them. They look like little light yellow spots or little tiny bumps in the oral cavity. About 80% of the population has these. And like I said, they're not abnormal at all. It's just a different characteristic. A fissured tongue has a wrinkled, deeply grooved surface. This is an example of a fissured tongue here. A bifid tongue is where two lateral halves of the anterior 2/3 of the tongue fail to fuse completely, and an extra tag of muscle at the end of the tongue exists. I don't know if there is a picture of a fissured tongue here. Yeah, there's a bifid tongue. So if there is a bifid tongue, no treatment is necessary unless a large tag of tongue is annoying them. And then if they do have that, it can be surgically removed. Ankyloglossia is where the tongue is literally tied to the patient's jaw, and the patient is unable to lift their tongue completely. This is also known as being tongue-tied, and this can actually be surgically corrected by an oral surgeon. Okay, so enamel that appears opalescent and easily chips away is a characteristic of which disorder?
It was called enamel that appears opalescent. You just told me this. I forgot the name.
So this is a dentinogenesis imperfecta. Very long word. You can just be abbreviated DI. But yeah, that's just when the enamel chips away, it's brittle. It has that opalescent or chalky appearance. Yeah, that's what that is. So we also have nutritional disturbances in the mouth. Angular cheilitis involves both mucous membranes and the skin. So it may occur in patients who constantly lick the corners of their mouth, or if they lose vertical dimensions of their face. When people lose vertical dimensions of their face, that's because they lost all their teeth and their mouth literally collapses. This causes more complications because it allows microorganisms to grow in an opportune environment. So you can think of someone's face that collapses, it causes lots of wrinkles, extra tissue that kind of folds on top of each other and causes creases in the skin, which can cause this sort of fungal infection to occur, called angular cheilitis. People also lick, like I was saying, lick the corners of their mouth. If you look in the commissures of the mouth, remember in the corners of the lips, if we see cracking in the lips, usually that's a sign of angular cheilitis. It's not infectious. It kind of actually is, because it's from patient to patient, but it's not infectious to you. But it can be uncomfortable for the patient, so just be careful that you're not pulling on the area too much. Glossitis creates a ball tongue appearance and may be painful to the patient. This can be caused by a deficiency of vitamin B, and it's just the inflammation or painful inflammation of the tongue. All right. So neoplasms is just a medical term for a tumor. And it can be benign and malignant. So dental assistants should be knowledgeable and act on recognition, which could save a patient's life if detected early. So neoplasms or tumors have a great potential to become malignant if they're not already. So if you see something that looks funny to you, again, you never want to diagnose this because let's face it, you don't know, the doctor probably doesn't know either. But you want to inform the dentist without alarming the patient. And I want to put a lot of emphasis on that because if you see something funny in the mouth, you never want to alarm a patient or tell them, oh, I think that could be cancer. If you say stuff like that, it can cause this downward spiral of aggressive anxiety for that patient. They might not sleep for several days, which is problematic because a lot of the times when you send somebody in for biopsy, it can be several days and sometimes weeks before they get an answer whether or not it's malignant or not. So again, don't ever alarm a patient if you see something funny. Let the dentist know, and then they can take it from there. Okay, so oral cancer warning signs include sores, lumps and swelling, white or rough lesions, and unexplained mouth dryness. The white or rough lesions can be in the mouth or the lips. If you notice lumps or swelling, it's usually in the mouth, lips, or the neck. So a lot of times when dentists do their oral exams, they'll do the oral cancer screening. Well, they'll feel all around or palpate all around the bottom or the underside of the mouth where lots of lymph nodes can be. And if there's swelling there, then they'll know to look further for stuff. Sores can occur inside the mouth, and these are sores that don't heal on their own within a month. So other oral cancer signs are numbness in or around the mouth, soreness or burning sensation in or around the mouth, difficulty speaking, chewing, or swallowing, and repeating bleeding in the same area for no apparent reason. Types of neoplasms include leukoplakia, which is a white leathery patch that cannot be identified as any other white lesion. Biopsies are required for further identification to know what this is. And this is this like white leathery patch that we see on the bottom of this patient's lip. So leukoplakia results from or usually show hyperkeratinization, but it can also show dysplastic cells. And this is something that's just not something that you can see, but this is something that's seen by a pathologist whenever a biopsy is sent in. So there's controversy over whether this is a pre-malignant condition and should be examined periodically for any changes. Lichen planus initially occurs on the lower leg or ankle, but we do see it sometimes in the oral cavity as lesions that begin as small white papules that group and form into interlacing white lines that we see kind of this is the inside cheek of somebody. And these little white lines that interlace are called Wickman striae. And then just like those other type of neoplasms, those leukoplakias, there is a controversy over whether this is a pre-malignant condition and should be examined periodically for any changes. Erythroplakia is any red patch of tissue in the oral cavity that cannot be associated with inflammation and is a very dangerous lesion. It most commonly can be seen in the soft palate, retromolar pad area, which is right in that kind of meaty area right behind the last molar, or the floor of the mouth. It usually is found in patients over 60 who have used tobacco and alcoholic beverages chronically. Squamous cell carcinoma is a cancer of the squamous epithelium. And then benign forms are called papilloma. So it can be, if it's a benign, it would be called a squamous cell papilloma, not a carcinoma. Carcinoma denotes cancer. So here's just an example of the two different types. On the left, this is a patient with a basal cell carcinoma. This is actually cancerous. The patient has that cancerous lesion there. This patient on the right, we see a papilloma, which is looks like it's on the palate of this patient, on the roof of their mouth. It has that little kind of bulgy cauliflower-like appearance. Usually things like that aren't cancerous, but nevertheless, the dentist should explain that a biopsy should be done just to make sure that it's okay. A fibroma is a benign tumor of connective tissue cells, which are cells that support and surround structures. A fibroma is a reactive hyperplasia rather than a true neoplasm or a true tumor. They're usually dome-shaped and pink-colored and smooth. So we have some oral lesions related to AIDS and HIV. Candida albicans can be found in people who have AIDS or have had prior cancer treatment. Patients often report a burning sensation in the infected area. And Candida albicans is a type of fungal infection that people with normal immune systems could normally fight off. But anybody that has had cancer treatment or their immune system is compromised by AIDS can get these fungal infections that pop up. Kaposi sarcoma is found in AIDS patients and was uncommon until about the 1980s. And it actually spreads pretty rapidly. Treatment is low doses of radiation and chemotherapeutic drugs. Hairy leukoplakia appears like candidosis, but cannot be removed by wiping with the gauze. It is not painful and no treatment is available. Acute necrotizing ulcerative gingivitis, also known as ANUG, is a condition seen in young adults and teens. This is just ulcerative gingivitis. We can see this kind of bulbous or ulcer looking, I guess, swollen gums around this patient's mouth. A mucosally is found on the mandibular or anterior lip. With mucosales, it's usually people that like to bite the inside corners of their lip. When you do this, sometimes you can cause scarring tissue that will entrap these minor salivary glands. And when you do that, it kind of acts like a water balloon, and these salivary glands just kind of, there's nowhere for the saliva to go. So it'll just kind of balloon up into these little, well, they're called mucosales. They're like little bubbles that form. A varix is a condition primarily seen in the elderly, where the normal blood vessels become weakened and extended. Geographic tongue is found in less than 2% of the population. And it's actually pretty interesting when you see it. I believe there's a picture on page 655. Excuse me, figures 27-38 has a picture of geographic tongue. And it almost looks like raised geographic areas. So if you're looking at like a 3D-ish picture of a map with all the different topographies on it, it sort of looks like that. There's nothing wrong with it. A lot of times these geographical ranges, you can kind of call them, will change over time. And the tongue will often appear like it's changing shape constantly. Anorexia, so these are just some miscellaneous disorders. Anorexia is a disease where loss of about 15% of body weight occurs, and there is an intense fear of being fat. And bulimia is an out of control eating followed by vomiting. And these manifest in the mouth from somebody, especially somebody that vomits a lot. We'll see decalcified teeth or eroded enamel, especially on the lingual surfaces of teeth. And that's because when people vomit, the vomit will hit the lingual surfaces of their teeth, which is very acidic, and can cause that enamel to erode pretty drastically. This can also cause deterioration of existing restoration. It can cause rampant caries and enlargement of parotid glands, which are salivary glands right below your tongue area. And then Bell's palsy is just a temporary paralysis of the muscles on one side of the face. The cause of it is unknown, although there are some relations to shingles that have been found. So again, it's just a temporary paralysis on one side of the face. Okay, so that's all I have for chapter 27. That was the end of the chapter. Does anybody have any questions with any of the slides that I went over?
No,
No.
I don't think so.
Okay, let me go back to this here. Okay, so I just wanted to go over the assignments for, I guess, for tonight, or what's expected to be tonight. So the first assignment that's due, and it's going to be due by 10 o'clock today, are the quick checks, the mind tap exercises. I would like for you to do all odds. So 27.1, 27.3, 27.5, 27.7, 27.9, and 27.11. It should take you about 30 minutes to finish all of those for tonight. I also want you to do the following mind tap activities. These are in chapter 7, 7.23 and 7.24. Those are the nerves of the maxillary arch. And then 7.25s are just some information on the nerves of the mandibular arch. So these will help you with the nerve quiz that's going to be due for everybody by the end of today. Also, there is a Franklin Covey assignment. So this is the 4 ways to strengthen peer networks. Should take you about 30 minutes to complete that. And then finish up your final study guide. Spend about 30 minutes on it if you need to. That's not due again until Monday, but try to get that turned in as soon as possible so that I can give you some feedback that you can study on. Also finalize your DEN 120 portfolio projects. A reminder, this is worth 30% of your course grade. So it's going to be really important that you kind of make sure you go over all of those, all the items on the rubric so that you know how you're going to be graded. Study for the nerve quiz. The test date is going to be the same date as the final. So that'll be Tuesday on the 12th. And then study for the final exam. That test date is also on the 12th. If you go over, and I know you've probably seen this before, and every chapter always have some study materials here. The stuff that's in there will help a lot with the stuff on the final. So I would just kind of, if you're have some studying time and you're kind of wondering what should I be studying for, the best thing that I would recommend doing is just to go through all of these study materials for all the chapters that we went over. Just make sure you know all of the information from those activities. Any questions with that so far?
Will you be uploading the following slides that we just that you were just presenting?
Yeah. Look over them again. And then which one did you have a question on?
Oh no, just the actual the
slide itself?
Yes, sir.
Yeah. That's this one right here. And then I'll also be putting up copies of the slide that should be actually on somewhere on here. PowerPoint should be there. So all of these should be there in case you want to go back and use those to study off of, which I do recommend, by the way. All right. Any questions with anything that I went over today at all?
No.
Okay. If you have any questions, feel free to email me. I will be available till sometime around 10 today. Don't forget to turn in that 10 p.m. assignment that I'll be using to mark your attendance. And if you don't have any other questions, that's it for the week. I hope you guys all have a good weekend. This is our last chapter for a lot of you that are on here. So congratulations, we got through it. Monday, it'll be more of a review type of session for the final on Tuesday. Sound good?
Okay.
All right, good night, you guys.
See you. Thank you.
Thank you, you too.
Bye. Have a good weekend.
You too.
Bye.